I'm Dory Demers, and I'm the Rise Vermont coordinator. Rise Vermont is a community initiative to embrace healthier lifestyles, improve the quality of life, and reduce healthcare costs of where we live, work, and play. We are pleased to bring you Rise TV, a weekly syndicated show on Northwest Access Television, bringing us all tips, tricks, and resources to embrace a healthier lifestyle. We are thrilled that we are partnering with the Vermont Department of Health St. Albans District Office to offer these tapings as WIC-approved activities. Please be sure to listen for your WIC-approved phrase that'll appear at the bottom of your screen here and also be told by the co-host. This will be what you will have to report back to your local district office to get credit for your second nutrition education. If you'd like more information about Rise Vermont, head to www.risevermont.com or follow us on social media. I really hope you enjoy the show, and thank you for joining us in embracing a healthier lifestyle and creating a healthier community for all of us and generations to come. Thank you.
Hi, and welcome to Rise Vermont TV. My name is Brian Kluke, and I'm the Rise Vermont Health Coach. Today we have a very special guest from Northwestern Medical Center, Debbie Robertson, who's a certified diabetes educator and a registered nurse as well. So thank you for joining us today, Debbie.
Thanks for having me, Brian.
So I'd like to start out today just to talk a little bit about your background, where you came from, your education, and what brought you here today.
Sure. So I'm a registered nurse. I've been at the Northwestern Medical Center for about 22 years doing diabetes education most of that time. I'm also a certified diabetes educator, which means I meet with folks who either have gestational diabetes, pre-diabetes, diabetes, just to help them better control their health and their diabetes. I'm originally from Franklin. I live in Highgate now. And I'm here to hopefully help somebody learn a little bit more about how to control diabetes, what it is, who should be tested, things like that.
Excellent.
Yeah.
Perfect. So let's get started with, the folks watching, if no one knew anything about diabetes, I'd like to just jump into background of what is diabetes.
Sure. So there are several different types of diabetes, but essentially what happens when someone eats their food, sugar is introduced into the bloodstream. Your body is to make insulin to help lower that blood sugar. And when someone has diabetes, there's something going wrong with that system. So blood sugars can be higher than normal. People can, over time, suffer complications from diabetes. So good blood sugar control, good diet, good exercise, the right medications all help to prevent those complications.
So you mentioned blood sugar or sugar levels relating to insulin production within the body. So to simplify it or talk about it a little bit more, so that means diabetes is only related to sugar, correct?
Not necessarily.
No.
There are several different types of diabetes, but overall in general, just to make it simpler, someone without diabetes has a blood sugar that's less than 100 in the morning. Someone with type 2 diabetes would have a blood sugar higher than 125 or 126. Someone with prediabetes, which is someone who's sitting on the fence, not yet diagnosed with diabetes, would have a blood sugar in the morning between 100 and 125. So it's really important at least once a year for folks who are at risk, over 45, family history of diabetes, to have a blood sugar test by their doctor once a year. Because the earlier we detect it and the more control we have at the onset, the less likely they are to have problems in the future.
You mentioned a few good things there, family history, which kind of runs through a bunch of different diseases, not only diabetes. But to touch on that as well, so if someone, watching again, knew their family history, they may have one or two family members with type 2 diabetes, correct? What should they do? Are there any symptoms that they may feel or see with diabetes? Is it hard to see symptoms?
So at first, often people with prediabetes or those at risk won't have symptoms. Symptoms usually occur when blood sugars get higher. But symptoms that you want to watch for are increased thirst, so wanting to drink more and more, getting up at night, especially to go to the bathroom often, things like very sleepy or tired after you've had a meal because your blood sugar could go up at that time, dry skin, frequent infections, just not feeling up, just not feeling tired, So again, symptoms are often after blood sugars are high. So that blood test once a year, if you've got a family history, is so important.
And is there with that blood test, they would have to go to Northwestern Medical Center or an area or a local hospital to get it checked?
Sure, any provider can do it. It can be done right at your doctor's offices. There are kits there, or they can actually include it in your routine blood work when you have your cholesterol or all of those done.
Okay.
Yeah.
And what does that look like? You know, I'm curious as far as your blood sugar level, getting it tested annually. I just wonder, so I guess would it have to be fasting type of test to keep it consistent every year for them to check? Or?
It could be fasting, or there's something called a glucose tolerance test that can be done, but fasting is all that you need to do. You go in after you've been without food for about 8 hours, nothing to drink other than water. And it could be as simple as a finger pick, or it can be that blood draw that they send to the lab.
Okay.
So it's a screening, really.
Yeah.
Yeah.
Excellent, excellent. So as far as, you know, that's all the preventative care for diabetes.
Sure.
What if someone were to have diabetes and, you know, they're kind of hesitant on their next steps? You know, it is rather strict, as I believe, as far as next steps, you know, what you need to do as far as making it manageable. So I just wonder if you could touch on that.
So when someone's first diagnosed with diabetes, we would love to see them. Myself and there are 2 other certified diabetes educators at the hospital. All we need is a referral from the doctor. We sit down with that person, go over their past medical history a little bit with them, and then focus on really 3 to 4 primary things. One being healthy eating, the other being exercise, and it can be any form of exercise. We work with somebody whether they can walk or not, and come up with some achievable goals for them. Then we also look at medications, and there are, you know, multiple different types and classes of medications for type 2, so we can sit down and talk about what those are, what you can expect for benefits and side effects. We teach them how to monitor their blood sugars, give them a kit so they can be testing at home to see if these changes are improving their blood sugars. Then some of the other things that could affect blood sugars that we discuss are stress, pain, and illness. You know, if those are going on, it can make it hard to do the other healthy, you know, components of eating right and exercising. So it's a real nice comprehensive visit. We initially meet one-on-one when they're first diagnosed or when they need help, and then we can rejoin or get back together in 1 month, and 3 months, and 6 months. So it's not a one and done type deal. We're there to help support them. We also have a quarterly diabetic support group where we have different guest speakers and different topics related to diabetes. We have group classes that run for 5 weeks. We have a whole menu of options for folks that fit into their lifestyle.
So it really sounds like all these programs, you can really meet someone kind of where they're at.
Yeah, we even go outside of the hospital. We meet people in Richford, Alberg, Enosburg, have some of our groups in Alberg and Richford. And so we're trying to make it as easily attainable as possible, remove those barriers so people that want the education or help can get that.
Perfect. Today's WIC certified activity code is blood sugar. So I'd like to talk about a few things. You mentioned in the one-on-one sessions that someone could come with you if they've had diabetes, but could it be the whole spectrum to see a certified diabetes educator, or would someone not make that referral? So if you were pre-diabetic,
sure,
could you get that referral? Or
yes, definitely. All we need is that call from the doctor or that fax from the doctor saying we'd like you to set up the appointment. We try to do that within a 1 to 2 week time frame. We have diabetes funds, we have scholarships available. We do provide those in case someone's insurance doesn't cover it.
You do?
Yes. And the support groups are free, and we also have several different workshops through the Blueprint for Health, Healthier Living with Diabetes, and the YMCA Diabetes Prevention Workshop, which are no charge to the person.
No charge.
So there should be something for anyone who wishes to have that education.
Excellent. You know, another one of the points today I'd like to talk about is you talked about the quarterly classes. Was that the same as the outreach, or is that something, because you mentioned you go beyond Northwestern Medical Center to Richford, Franklin, those are some of the areas you listed?
Sure.
So are those different, or do you do specific groups, if that makes sense?
So there are multiple different groups in multiple different locations, and each year there's a new schedule, and some of it is dependent upon what the community is asking for. Currently, Enosburg's asking us to come up and do a diabetes workshop for their senior SASH group.
Okay.
So some of it's based on what the community is asking for. The quarterly diabetic support group, that's the second or third Monday of every month. It's at the hospital, free lunch, free dinner. We just ask that people call and register so I know how much food to order from our kitchen. So that is set at the hospital in the conference center. And we typically have 45 to 60 people who attend the lunch and the dinner. So it's pretty well received by the community.
Yeah. Sounds like it. So that quarterly visit is free of charge. Just need to pre-register.
And a meal is included.
And the meal is included.
Yeah.
Excellent deal.
Yeah.
So we've talked a lot about diabetes and how you interact with the community, as well as work with individuals one-on-one. But as far as diabetes itself, I'd like to talk about the differences as well.
Sure.
A little bit. So there's, as far as I understand, there's type 1, there's type 2, and then there's gestational. So would you like to go over real quick?
Certainly.
Just the...
So gestational diabetes is probably the most clear-cut. Someone who's pregnant and in their third trimester will have a drink, and then blood tests will be checked to see how their body tolerated that sugary drink.
Okay.
So if it's outside of a normal level, then they'll come in, they'll meet with a nurse or a dietitian, myself or one of the dietitians, and we'll go over, again, carb counting, healthy eating, exercise, blood sugar monitoring. Usually once the baby's born, blood sugars totally go back to normal.
Level,
but you are at risk for diabetes later on in life. Type 1 diabetes used to be called juvenile diabetes, so it occurs more often in children or young adults. They're often losing weight, sick, thin. That's diagnosed by blood tests as well. Those folks require insulin, injections, or pump. And that's the medication treatment for type 1.
Okay.
Type 2, it usually is over the age of 45, family history, high blood pressure, high cholesterol, carry more of the weight in the abdomen or more apple-shaped. And with type 2, it's a lot of lifestyle modification, maybe weight loss, exercise, meal planning, and medication, stress reduction. Type 2 tends to improve with weight loss. And if it's caught early enough, blood sugars can actually go back to normal with 7 to 10% weight loss. So those are some of the things we look at with type 2. Prediabetes is the one that if I can get somebody to come in and make slight changes when they're first diagnosed with prediabetes, they might not even they might not become a type 2 later on in life. So that's the 7% weight loss, the lowering the cholesterol. So type 2, there are a lot of people out there with type 2, but there are even more who have prediabetes that aren't aware. So that screening, again, coming back to that is so important, at least once a year.
Yeah, and it's good to know that you can get the screening and then meet with a certified diabetes educator right here in the community, or as you've told, you can do the community classes as well. Catch it before, and then you would target the same things you mentioned: weight loss, lifestyle change, physical activity, if needed, exercise, and nutrition as well.
Right.
Excellent. Yeah, I believe that's all we go over. And so you did talk about all the different types of diabetes, and you mentioned getting back to normal blood sugar levels. I guess the last question I have for you is diabetes, I don't know if curable is the right word, but...
So type 1, you would need to have a pancreatic transplant or a transplant of an organ in order to produce insulin and no longer need to take it. Rare cases with a lot of weight loss and type 2, blood sugars go back to normal, but if people gain that weight back, we often see the blood sugars go back up. Prediabetes, if someone is caught early and makes those lifestyle changes, we can often see blood sugars go back to normal, and 50% of those people never develop type 2.
Wow.
So, and gestational, like I said, once the baby's born, usually blood sugars go back to normal.
Perfect.
Yeah.
Awesome. Well, that about wraps up our show. Is there any contact information if anyone would like to reach you, or would it just be a referral process?
Sure. I mean, they can call for information, either myself, 524-1031, or our assistant Chastity at 524-1227, and we can walk anyone through the process of how to be seen, or even, talk over the phone.
Perfect.
Yeah.
Excellent. Well, thank you very much for tuning into this episode of Rise Vermont TV. I'm Brian Kluke, and our special guest. Thank you very much for being on our show, Deb Robertson from Northwestern Medical Center, and we'll see you next time.